So, Nicole, you and I have been working together for over 10 years.
I know.
I've watched your practice evolve so much. Think back to about a decade ago. What kind of chronic pain cases were walking through your door, and what was your standard approach back then?
So I would say primarily, I definitely saw a lot of people with like desk jobs. And so chronic neck tension, neck and shoulder tension, low back tension, usually from sitting a lot still. And then for the most part, because I was working at a chiropractic office and most people wanted, they were just focused on getting the pain gone. I was definitely, my approach to getting rid of it was, kind of that no pain, no gain
Mhm.
approach. And so definitely getting in there, sometimes elbows deep into whatever I needed to get into and kind of force the tissues into submission. And so,
Mm. So, we both know those clients who feel like they've tried absolutely everything. They've tried some chiropractors, physical therapy, and regular massages. And they're just exhausted by the time they get to you. So, what does that stuck starting point look like for them?
so typically by the time they come to me, they are, for the most part, they're in survival mode. They want to get out of pain. They've been everywhere. They've done everything. In some cases, people are talking to them about surgeries and I mean, like
Yeah.
nerve ablations and really horrible sounding things that they just don't want to go through. So when they come to me, it's like fix me, And so they've, tried everything and now they're frustrated. And most of the time, the reason that I would go in the direction of, get in there as quickly as possible and as aggressively as possible to get things worked out because of the way that they were present, in that state of I haven't, in some cases, I haven't even been able to sit down comfortably for a couple of weeks. And that's all they want to do is just to be able to sit down. And so, for the most part, they are here feeling like, I don't know what else to do. And I've tried everything else. And at this point, they just feel betrayed by their bodies and they just want some sort of relief from what they've been going through.
That's an interesting way to. I love the way that you just described that, um, which is, shoot, I just lost it.
The
What did
feeling
you
of
say?
betrayed by their body.
Yeah, feeling
Yeah.
betrayed by their body. Like that, that totally hits it.
Mm-hmm.
Um,
Yeah.
because they want to so badly to not have this pain.
Mm-hmm.
And they're like, I don't understand why this is happening. My body hates me.
Yeah.
I've heard that
Mm,
exact
yeah.
phrase from hundreds of people.
Or I need a new one. Just give me a whole new body. Like I definitely heard that one. So
Yeah,
yeah, like
yeah,
it's just like they just feel like it's completely against them. So
yeah.
yeah.
I wish we could have this like body trade-in program, you know? It's like every 20 years you could just trade it in. I would do like 25 to 45. So I got 1 year left and then poof, that would be my plan. That's not happening. Um, I think one of the things that really sets your treatment apart from any other practitioner that I've ever seen or even witnessed with a client is your ability to really sit and listen with that person and really hear all of their symptoms and get a feel for what they want. How did you get there? How did you develop that skill? Or is it something that you just were born with?
Um, I I guess well, I've had lots of training. One, I started out as a cosmetologist.
Yeah.
And so, as a cosmetologist, like that's what it's all about. When you're behind that chair, you got to give people what they want. And so, the better at listening you are, the better at delivering what they want you will be. And so I guess it's just that. And then after cosmetology, getting into massage therapy where that was reiterated. And then even after that, going into, nursing school where that was even more so reiterated and not just how to listen to the patient, but how to advocate for them, because sometimes they don't really know what they want. And so trying to help piece together everything that they just said. And sometimes they're panicked. And so, they're kind of throwing a whole lot at you at a time, at one time. And so I guess it was just all the training that I've had over the years. I've always felt like even when I was training massage therapists that I had it a little unfairly because I started out as a cosmetologist. And so I got certified to do massage then, but I was only able to do relaxation. So I had to get extremely good at giving a relaxation massage. Like for me, it was, since I can't do therapy, if you come in here and you say, oh, this hurts, I have to tell you, well, I can't really work on it. So then my philosophy was, I'm going to relax you. I'm going to make you feel as good as possible. And so you're going to kind of forget about the fact that I just told you I can't really directly treat your problem. And so through just years of that, years of really just kind of focusing in on, I guess, the nervous system. How do I get the nervous system to calm down? Because although I may not be able to do any therapy, I can definitely reset their nervous system, get them out of fight or flight into rest and digest. And so I guess it's just been years of training. Actually, I can't even say it just came all on my own. Now, I am a very present person, and I think that that's what it is. When I'm talking to people, I'm 100% here. So, I mean, of course, there are going to be times where if there's something going on, I may not be. But when I show up in the room, for me, I'm here for you. I feel like anytime anyone does anything for money, like you're choosing to get paid for that. You should be willing to do everything that you possibly can. Like this isn't just something you're volunteering at. You're choosing to get paid for it, so you should be really good at it. And I just found that when it comes to massage, or at least servicing people, the best way to do that is to be a good listener. So just being able to listen and not just listen to the stuff that they're saying, but listening to what they're not saying and what their body is saying is definitely key. Like, because sometimes the reality is that most people just don't know what's going on in their body. And, there are times where something has changed and, people are like, oh, no, it's still the same. And, you have to like kind of, I guess, almost point out the ways in which things have changed, and then it's like, oh yeah, that's right, that was like that before, and now although there's still something there, it's different from what it was. And so letting them know that, hey, that's progress, that's change, and just bringing them that body awareness is part of it, and so that they can I guess be more successful. But yeah, since they don't know, I figured so many times I've been in the treatment room and they're just like, I don't really know. After all that they've said, with all of that, I don't really know what to do. And so then having to like, okay, well, we got to go somewhere. So I'm going to figure it out. So it was just something that I felt like in order to be the best therapist, I had to be a good listener. And that's how it came about. Lots of training, lots of school.
That's awesome.
Lots of communicating with people who like just weren't really sure, and like we got to go somewhere, so we can't stay here. And so it's like, okay, we got to figure something out. So yeah.
Yeah, it sounds like it's because of necessity. And when you really care about this person in front of you, you just feel this pull. You're like, I want to help them as best that I can.
Definitely.
And so when they're talking about something and they're really trying to get their point across, but maybe the point isn't as clear to the person listening to them, then the person that's doing the listening starts to develop this skill of asking the right questions.
Right.
And I've noticed that with you for sure. You listen to everything that they're saying, and then you ask like clarifying questions, and that tends to really bring out the information that you need for that treatment.
So I guess to that, I guess it is somewhat born with, because there is a natural curiosity that I have. So sometimes people will say something and it's like, okay, wait, that's not making sense in my brain. So I need to ask questions so that it makes sense. And I think I've always been like that, actually. So, and fortunately, My mom was great. So she never cared if we asked questions, and we were always encouraged to ask questions. And so I just developed this habit of asking questions. And usually when I ask a question, there is like a specific answer that I'm trying to at least eliminate, if not get to. And if I, depending on where we go from that question, I can kind of come up with an understanding of, what's going on and how to proceed. So yeah, I guess there's a part of it that's just natural and it's always been there because of the curiosity that I have and the, love I have for people.
Which you definitely have.
Yeah.
So yeah. So I remember talking to you years ago when you were really affected by the physical toll massage was taking on yourself and on your clients. And the hurt so good mentality was really seemed to be like the catalyst for that. What was that breaking point for you as a therapist when you realized, okay, something needs to change?
So first, I would say it was just recognizing that I love doing massage. It's been my first love. I'll tell anybody that it's my first love. And so the idea that I was going to have to stop doing it, it was like, I really felt like it was what I was called to do. And it didn't make sense. Like, if it's what I'm called to do, why would I have to stop doing it? And so I guess the breaking point for me was like being forced to look at, if you're going to continue on in this, you have to do something differently. And then part of it was just intuitive. Like, the more I learned, it was like, okay, the nervous system is highly connected to the body, right? We kind of can't work on the body without affecting the nervous system. And if everything I'm learning is saying, in order for the body, if everything I'm learning is saying the body can heal itself, but in order for it to do that, it has to be in parasympathetic, that rest and digest mode, then the best thing I could do for a patient when we get in the room is to get them there and rest and digest, because unfortunately the reality is that most of us spend our time in fight or flight. And even when we think we're resting, we're thinking about what we got coming up for tomorrow or next week or what we've just gone through. And so most of the time we're under sympathetic nervous system tone. So that rest or that fight or flight. And so the more I thought about it, the more I learned, it's like I have all this schooling, and the more I learned, it was like, this doesn't seem to be right. And maybe it was that connection once I connected the medical, because although we were doing medical massage, like going to nursing school and actually really seeing the medical side of things, not just like the holistic side of how you can treat a person or how you can treat the body, it was definitely very eye-opening, and it just made me realize, like, okay, although this is what I've been taught, maybe it's not the whole picture. And so just realizing that, one, I love this and there's nothing else I want to do more. I mean, again, I went to nursing school and then paralegal school to try to, come up with a plan B, and, my heart was just pulling me towards massage. So the realization that if I'm going to stay here, I have to do something differently. And then also the realization that, no, maybe this is really not even beneficial for the patients, because at the end of the day, that was the only reason I was doing it, was for their benefit. And so if it's not benefiting them, then I definitely need to do something different. And that just came by way of learning. And even just the more I practiced, the more I could see, there's things aren't really adding up the way, under this, like, that whole no pain, no gain, hurt so good mentality, things aren't going exactly the way that I think that they should be going anyway.
So you didn't just accept that limitation. You opened your mind, you experimented, and then completely reinvented how you treat the body. What is this new approach you've developed, and what do you call it?
Yeah, so the new approach I've developed is called neurofascial integrative therapy, so NFIT. And basically, like I said, it's just the culmination of everything I've learned, both while I was even in cosmetology, as a cosmetologist, as a massage therapist, even as a nurse, like everything just coming together, and recognizing that we all know that frequency is all around us, and our bodies, each individual body part realistically has a different frequency. And so being able to tune into that specific frequency, whether we're working with the lymphatic system or even if we're just working with the skin, that is a part of the healing. So even when someone comes in and they have a deeper issue going on, we have to still consider what's going on the surface, what's going on the skin. And so just recognizing that the body works together as a whole. So when we treat it, we have to treat it as a whole, and not one thing is going to treat the body as a whole. So we can't just approach the body with lymphatic drainage and think that everything's going to get better. Just like we can't just approach it with deep tissue massage and think it's going to get better. We're working with the lymphatic system, we're working with fascia, we're working with muscle, we're working with all the connective tissues, including the fluids in the body. And so when we consider all of those things together and the way the body works together, to give it or to try to just approach it with one tool, one even type of tool, would definitely do it a disservice, because there's so many things going on. And then not only the physical stuff, we have to consider the mental and emotional stuff, because everything that happens to us mentally and emotionally, our body reacts as well. So, our nervous system is there to make sure we can stay alive. So when we encounter, whether it's a mental stressor on our way to work and, maybe somebody cuts us off, unless we actually are doing something to move that out of our tissues, our body, it reacts, it holds on to that tension, and it says, there is danger, and until you do something about it, it's going to hold on to that danger mode. And so that danger mode looks like fight or flight, and so it's stored in the body. And so unless you go in and tell the body, like, hey, it's okay to let this go, we're safe now, we don't need to be here, it won't turn off. So we gotta make it turn off, and that's the only way to make the sympathetic nervous system turn off, is to turn on the rest and digest parasympathetic nervous system. And so it's just about doing whatever the body needs. Like, so in that time that we're in that treatment room, we're doing whatever we need to do. So if that's lymphatic drainage, that's lymphatic drainage. If that's myofascial release, it's myofascial release. Usually there is a pretty good combination of a lot of different things for most people, especially depending on how long they've been in the condition they're in. But it's a whole, just about everything that's in my toolbox. I'm even taking a trauma-informed breathing class. I'm going to start taking a certification for that. I've already started a breath work certification, but this one specifically is going to be for trauma-informed. So that's actually going to even open up things a whole lot more. And so I've started incorporating breath work more into it, just starting out with teaching people how to breathe, so that abdominal breathing, making sure your exhales are longer than your inhales to really engage the sympathetic nervous system. So even incorporating that into my treatments, it's been amazing how much things have changed. So the approach that I've just taken now, and I guess I just finally got up the courage to take, versus, I've worked so long the way I thought I was supposed to, and, according to other people's expectations. So this approach is definitely, I would consider it more artistic. So it's like, I have all of these tools, and I have a really good understanding of the way the body works. So I'm really good with anatomy. I know what it's supposed to look like. I know what it's supposed to be doing. And so when you come in and you're telling me that it's not doing those things, I have a whole toolbox full of things that's going to help it, whether it is something that's a little deeper or something as superficial as just you, in teaching you how to use your own breath to, help move from that area of stress or that moment of stress to something a little more calmer. Like, so it's just an approach where holistic. So whatever it is that you may need, we're going to do it. And then with neurofascial integrative therapy, ideally it would be the longer treatment, even though I have started kind of, I guess, customizing it a little for the shorter ones. But for the most part, it's just this idea that you're a whole person with a lot of different systems going on. We know that there's 11 different systems in the body. And so all of those systems, when they come together, they make up you. And so if we're not addressing all of those systems, then we're definitely not addressing you as a whole person, which means that your pain could be that you're holding on to some stress that could have been from your childhood, or it could have been your body's holding on to some injury from childhood. You fell off your bike when you were 5 and you don't remember, you have no memory of it, but your body is holding on to it. And so to be able to go in and address that and be aware of it, that could be a possibility, that's definitely just the approach that NFIT it's taking. And so that's the idea behind it, is just a full body, whole person. Whatever you need is what you'll get when you're in the treatment room receiving that treatment.
So with NFIT, there's a physical component, right? But it sounds like there's also an emotional component. Is that
Mm-hmm.
right?
Yeah, definitely. Yeah.
Because there's an emotional component to the muscle tension or the pain that the person is in. And sometimes that could even be from their own past, like
Mm-hmm.
some sort of trauma in their past. And then their body reacted to that
Mm-hmm.
previous trauma. And now it
Mm-hmm.
kind of gets stuck
Yeah.
there, as in it stays tight. And then their movement patterns change too, which then even furthers that tension inside of their muscles.
Correct, right. And unfortunately, most people don't understand that emotional connection. But again, your body braces. Even when you go through something emotional, it braces. And so this isn't like a little woo woo or anything like that. It literally, your body braces. Your fascia is there to protect you, it's the protection for your entire body. So when it braces like that, because you've encountered something, whether it's emotional or physical or even mental, that bracing, it stays there in the tissue, and it's a signal we're not safe, and until we get safe, we have to hold on and protect this area. And so that's usually what we're finding when people are coming in, is that their fascia is holding on to something and it's restricting everything. It's restricting the lymphatic, no, the lymph nodes or lymphatic vessels in that area. It's affecting the muscles in that area. It's affecting everything, connective tissue. And so really getting into the the core of that and being able to help the body release that tension, whether they are completely aware or consciously aware of where it's coming from or what that traumatic event was, it's still possible to get in there and release it, just simply because we know that, okay, this is the way the body holds and guards. And so now all we got to do is just kind of, it's almost like, I think of it like computer code. Like, I don't really necessarily know how computers work, but I know if I do certain things, because they're computer programmers out there that did their thing before I got here. I know if I do certain things, the computer's going to do and take me where I want to go. It's the same thing. If we do certain things to the body, and it's like it responds the way it responds, and it always responds that way for the most part, as long as it can respond that way. And so if we do certain things like put in that code and it's into that software, then it'll affect the hardware, and then it'll take your body to where we're trying to get it, and in this case to relax and release the tension. And so that's for the most part what I kind of look at it as, is recognizing that as I'm working on the body, it's like that. I'm inputting this code, and as I'm inputting the code for your body to relax, it's responding in kind, and then it's doing what I'm asking it to do without being forced into it. It's not a forcing. It's just it really is more of a flow and a let go. It's almost like a dance almost, versus even you know I would say even a therapy, is more of a dance. It's like their body has this specific frequency that's emitting this song, and when I connect to it, it's like a dance. The way it just flows along into to everywhere, and it just takes me into the tension and the areas that need to be treated. So it's actually really, really cool, really, really cool when I can. There's a lot of things that play into that, but the person being relaxed enough so that we can get there is definitely a big part of it. But it's super cool, because you really do get whatever you need. And I even had a patient yesterday ask me, like, well, what about for someone, this felt a little, it was perfect, but it felt a little deeper. What about, like, if my mom were gonna come here, like, would she be okay with this? And I'm like, well, actually, it's different for every person. not only is it different for every person, it's going to be different every single time you come in here. So, it's based on what you're feeling when you come in. So just getting present and in tune with wherever you are in that moment, and then just connecting to that and just flowing through that. And that's usually allows things to like calm down and relax enough. There is this kind of component of taking the body through its range of motion. So like once you've gotten into the physical and like allow things to calm down with the nervous system, and then getting into the tissue and getting it to calm down, retraining the muscles and just taking them through their range of motion. So there is definitely a stretching component to it as well, but that's just going to allow the muscles or in the body to go through the proper range of motion and kind of retrain things. And sometimes it is sending them home with certain exercises, or even if it's just breathing, something like that. So I guess that is the component, that kind of what you're doing here as well as what your aftercare is, I guess I would consider a component.
And breathing is most likely something that you want to incorporate in their aftercare. Is that right?
Definitely, yeah. That's something I've been even already sending people home with, that in just being more conscientious of it, how to breathe, the goal for breathing. And, it's one of those things that we all need to do and we're all gonna do it. And so our breathing patterns, like when we're doing the shallow breathing, like no matter what, our nervous system is perceiving it as you're being threatened right now. And so our breath controls a lot of it. And so even though it's something that's unconscious, it's there and it's going to affect us. So the more control we have over our breath, the more we'll have over our body. And so it's definitely something that I kind of walk people through as far as how to breathe, and then send them home with, at the very least, if nothing else, that information as far as how to breathe and to when to breathe that way.
What is the client actually feeling during this process, during this treatment, that makes it so different from just lying on a table during a deep tissue massage?
So, one, I would say most people, for if anyone who hasn't had a deep tissue massage, usually it's pretty uncomfortable. You're bracing, your nervous system is definitely, fight or flight, definitely firing. And so a lot of times you can have there's a lot of, or there can be some stress and anxiety just from getting a deep tissue massage because of the discomfort that we feel like you have to go through in order to get better. So with neurofascial integrative therapy, it's definitely more gentle, because once we take you to that place where you feel like you either have to run away or punch your therapist, you're in fight or flight. And so with that being said, we have to, my goal is to keep you out of fight or flight. I mean, hopefully for a while, but you may leave here and, go right back in. But while you're here, my goal is to keep you out of it. And so it'll definitely be more, it's more gentle. It's working more with your nervous system, because again, every single signal I'm sending is to say, hey, you're safe, you can calm down, you can let go of this tension, you don't have to stay in this position. And then training the nervous system as to how to be in that more relaxed state. So it definitely feels more just relaxing, more, I mean, I guess most people feel like, I've definitely had people say stuff like, I feel like I need a cigarette after that, stuff like that. And so it's definitely, it makes you feel like you don't want it to stop, versus with the deep tissue where you're just like kind of counting the seconds for it to be over. It's helpful. You're going to feel better after, hopefully anyway. But for the most part, you can't wait for it to be over. Whereas this is going to feel more like, no, keep it coming. Please don't stop. But it's working with your system, is working with your body, is considering the fact that no matter how tight you are, there is a level of touch that will not elicit pain, so that it will not stimulate fight or flight. And so just kind of working within that. So wherever you are when you come in, it'll be something that's gentle enough to meet you at that point, versus me forcing you to try to be somewhere you're not ready for. So that first treatment may be a little more breathing focused. It may be a little more lymphatic drainage focused, which is really light pressure, kind of relaxing. But whatever it is that you need, it's going to be in accordance with that, versus some preconceived idea or agenda that I have when when you show up. So it's just going to be to make sure that I meet you wherever you are, and it's going to feel like something your body wants, like it's needed. Most of the time, that's what people tell me, is that feels like it was exactly what I needed. And so that's really, for the most part, what you're going to feel like. It's exactly what you need, if that it makes any sense.
It's been really cool to see you develop this over the years. And often, like I'm able to see a client of yours like after you've treated them. And recently there was a person that we were talking about her neck, and she saw you for the very first time. She's had neck pain ever since she was a kid. And she's a person that actually likes really deep pressure. She just wants to get tortured a little bit. And that's great. Like I get it. I understand.
Mm-hmm.
And she had one session with you, and afterwards she was like, my neck has never felt like this before. I just cannot believe how loose it is.
Mm-hmm.
And now I'm feeling all sorts of different things in my neck because it's so much looser. And she did say that the approach is just so different from any other massage she's ever had, and that it felt like she was given exactly what she needed. And she identified that it started with the conversation you and her had before the treatment itself, because she felt understood. And then when she laid down on the table, her body was already relaxed because she wasn't worried about, oh, does this person really know what they're doing?
Mm-hmm.
Like she was comfortable in that.
Mm-hmm.
And she said that really helped her muscles relax, along with the actual therapy, the actual treatment in there. And she identified that it just wasn't the same deep pressure. It was something that was more of a flow, and the pressure was spot on. It was perfect.
Oh,
That was
good.
cool.
That's really cool.
Mhm.
I'm
Yeah.
glad to hear
Hmm.
that. Yeah, it's always kind of, I get a little nervous when I work on new people, especially if they come in and they've had massage before and they're used to that deep work, because I know it is so different. And I've worked on so many different people, and getting that same response that this is different from anything I've ever had. What is it, first of all? And you know how, like, I guess it's different, and what is it? And sometimes it is like, is this going to work? Right. And so usually once they come back, and lately especially, I mean, after working, and I appreciate the years that I spent working deeper, because it really taught me. I mean, it's like, it was like the perfect setup for now. It wasn't like I'm saying this stuff now just because it was what somebody else told me to say. I'm saying this stuff because after over 20 years of working in this, like I can see, like I've worked, like I said, I started out with just relaxation. So I knew what that could do. And then kind of coming into the chiropractic massage arena, pretty well, I would say it was probably about 5 or 6 years into my massage career. And so it changing from something that was kind of like this balance between, I guess, relaxation and therapy, to something that was like, for the most part, therapy with maybe a little hint of relaxation, because that was something I was always aware of. But after working in all the different ways, using all the different, treatments and different modalities, is definitely something that I can say from experience I have been getting since I've been working this way over the last, I would say it's probably been about 5 or 6 months that I've been kind of incorporating the neurofascial integrative therapy. And I've started having patients that I went from seeing, like, sometimes in some cases every other week, they were there for years, and for some people, to now they're only coming in like once a month, and they're like, I didn't start having discomfort until like a couple days ago. And so for me, like, to hear that, like, that's where I want to get my people, because I feel like if most people come in and they're like, I've spent my whole life feeling good, and now all of a sudden I just don't anymore. And so they're confused as to, one, why this treatment isn't working after just one time, and then two, why their body is rebelling against them the way that it is. And so getting them to realize, like, even though you started feeling the pain more recently, it's not something that just started recently, and with the exception of an injury, it's not something that just started. And so we have sometimes years of buildup, and so we have to take it through. We have to get rid of that years of buildup, and so Rome wasn't built in a day, and so we're not going to get rid of all of that tension in one day.
Is there a certain client experience that comes to mind recently that really seems to stand out for you when you think about how this approach is helping so much more than maybe how you used to treat in the past?
Well, one of the most recent, I had a client who I had been seeing for quite some time, probably about a year or so. And off and on, she's had different issues, and off and on, I've worked on her for like extended periods of time. But more recently, she had an issue with her back. And in that time, well, I'll say probably over the last month, she's had an issue with her back. And in that time, she's probably seen, I would say, probably about 8 to 10 different practitioners. I mean, sometimes seeing people like seeing a chiropractor one day, a massage therapist the next day, and then some other sort of functional medicine person the next day. So having these back-to-back treatments and, not getting any relief, or the relief that she was getting was so temporary that she would feel good, but then once she would start doing anything, whether it was picking up her baby or, cleaning up around the house, the pain would return. And so she was just very frustrated, and especially since, the last time I saw her, the way she described it was, I've done every sort of modality that is like every body work modality there is, I've tried it and I'm still in pain. And she was like, I felt the best after I saw you last. She was like, but it really only lasted maybe a couple of days. And so, I don't know what to do. And so after just listening to her and, she's giving me all of this information, because of course, not only is she telling me how she's feeling, she's telling me about all the different things that she's been going through. So trying to keep everything that she's been through straight was difficult. And then since she's been seeing so many different therapists or, body workers, that's been also difficult because I don't know exactly what they're doing. And if I don't know exactly what they're doing, then I don't know really what I'm free to do, because there's this definite component to the body where, again, the nervous system works with it. And if it perceives the things even that you're trying to do to help it as a threat, it's going to stay in fight or flight. So as we were talking and, she's talking to me about all of the stuff that she's been doing to try to help, I the first thing that came to me was maybe part of the issue is that you're just doing too much. Your nervous system, it's getting all of these deep, aggressive, to be honest, with some of the stuff that she was describing that the people were doing to her. Very deep, aggressive therapies. And in even like injections, trigger point injections and things like that into the muscle. And so I just felt like, more than anything, I'm surprised your nervous system is like okay with this. And I would be willing to bet that it's not. And so my thought going into the massage was, okay, we have to take that into consideration. And although this is a patient who likes really deep work, she's one who will, if I'm not going deep enough, she's like, can you go deeper? And even though I'm like, okay, I feel like I'm at my max. And so usually I would just let her know, like, okay, I'm warming up into it. I got to let the more superficial layers relax a little more, and then I can get in there. Otherwise, I'm just going to hurt myself. And so by this time I've turned over a new leaf and I don't want to hurt myself anymore. So as I'm considering that, it's like, okay, how do I balance what she feels like she needs with what she actually needs? And that's a big part of the neurofascial integrative therapy. It's because I'm just trying to stay present. I'm not coming in with an agenda beforehand. Like, I can just, whatever the body is saying it needs, I can just flow with it. So if 1 minute I'm in an area that needs neurofascial release, then we're doing neurofascial release. If the next minute I'm in an area that feels like it does need more like acupressure, then we're doing more acupressure. So depending on whatever it needs, and as it changes from moment to moment, if the person, because unfortunately sometimes people people have emotional breakdowns on the table as well. You can touch on an area and just a trauma arises that sometimes they're even unaware of. And so with that, you just have to be ready to change and adjust however, like, in accordance with whatever's going on. And so the main goal is to stay present so that I can be there, but knowing that at any given time that because of a therapy that you had before could affect, and I don't really know how, it means all the more I have to be kind of on high alert and considering all of the different components of what could have happened, what you may even do tomorrow that you haven't told me about, because she may have had another appointment set up for the next day and I just don't know. So it was definitely a situation where there was a lot going on. I mean, a whole lot. And I knew this was because this was supposed to be a longer treatment. This was a 5-hour treatment. And so because it was a 5-hour treatment, I know that, okay, in 5 hours, unfortunately, if this is approached incorrectly, we can do a lot of damage in 5 hours. But at the same time, we can do a lot of good in 5 hours, because one of the things we can do is just kind of slow down enough so that I can just fully listen to whatever your body's saying, whatever the tissue is saying. And then even as I'm working, sometimes, you'll think of something else like, oh, I forgot to mention this. And even that, when you say it, I'll be able to figure out how does that fit into things. Does it fit into things? And a lot of times it does, sometimes it doesn't, but I can, have it and I'll plug it in accordingly. And so it was just so amazing and rewarding to work with her after all of that. And then when I finished, after 5 hours of work, she was like, oh my gosh, I feel so amazing. Like, it's just completely gone. She was like, I'm afraid to move, because she was like, I have not felt this good like since this started. And so after all of that, especially going into it, knowing that, okay, whether she knows it or not, we really are in more of a, we got to handle this like with a lot of intention. We can't go into this haphazardly, or with everything else that she's been through, like her nervous system can really take a turn on her. And so to get her to that point where she's just like, oh my gosh, I just like finally to have her life back. I mean, and for her, because a lot of times when people come in, they're not just this muscle hurts, I want to get rid of the pain. It's their life that they want back. They want to be able to sit down without pain, or sit at, their grandkid's soccer game, or pick up, she just wanted to be able to pick up her toddler. She was like, he keeps telling me to pick up. It's her first kid, only kid. And he wants her to pick her up. He's not even 2 yet. And he just wants her, actually, is he? Yeah, he's not even 2 yet. And he just wants her to pick her up. And she was like, the last time I picked him up, with this going on, I ended up dropping him. She was like, I can't even pick up my kid. And so just to be able to give that back to someone, and essentially that's what it is. You're like giving people their freedom back, and to be able to figure out after, and she's another person who's always said like, or did say, I think at this point I need to be bionic. Was her exact sentence. So just to be able to make her feel at home in her body again. I mean, that I don't think we really realize how much it affects everything. Like when we are feeling restricted in our body, it restricts the way we think, it restricts the way we feel, it restricts how much access people have to us, it restricts how much energy we have going out, it restricts everything. And so freeing up those tissues, allowing things to flow the way it's supposed to, allowing energy to flow through the body the way it's supposed to, is definitely going to make the person just as a whole feel so much more connected to themselves, and then to their lives, and then they can enjoy it, and it's so much more. One of the things that we always heard from the front desk was they just felt like it was so unfair when people would walk in, they would be upset with them, but then they would walk out after seeing the massage therapist and they're like so happy, and they're like, you get to deal with happy people, and we got to deal with them when they were cranky because they were in pain. And it was like, I get it, but pain does that to people, and it's one of the unfortunate downsides, but it's realistic. And so the more that we can get people out of pain and give them their lives back, the more I believe that we'll have a lot more happy people walking around. And the reality is we just were not taught how to live in this world. Like most of the time it's, if you're in pain, here, take this medication, or put on this brace. immobilize the area. And it's one of the worst things for a person. I had a person today come in and we've been working on her foot. And then today she told me she had been wearing a plantar fasciitis sling as often as possible. So holding her foot in this position, in the dorsiflexion position. And it's just like, and so I'm feeling her foot and I'm just like, I'm sorry, you got to stop doing that. And I actually had to tell her, I was like, I don't really like doing that to patients because I feel like to some degree, you should be able to, if you feel like it's helping, because she said, she was like, I feel like it might be doing better. And so I felt bad that I that I had to tell her, like, you got to stop doing this. But I let her know, I was like, this is why you have to stop doing it. And I could see the change. I mean, the horizontal arch in her foot was just about non-existent. And I'm just like, this has just been, I think I maybe saw her, maybe it was about a month ago. It was either 2 weeks, maybe 3 or 4 weeks ago. And it wasn't this severe. And so the thing that she's doing that she thought was helping, she's been having less discomfort, or at least she thinks so. But when I felt it, I'm like, your feet feel worse than they have since I even started. So that immobilization definitely it did a disservice, at least at this point in, her treatment. And so being able to give people their lives back, even though they have the best intentions, they're trying in some cases to do everything that they can to help, and they just don't know how to get there. And so being able to be a partner with them to get them there. And I never consider it I'm doing the healing. For me, I'm just creating an environment where your body can heal itself, because the body is really wise. It was doing this before we were really consciously aware of it. I mean, we were formed in our mother's wombs, like, without our intentions or without our knowledge, and it just knew how to do it. And so that same wisdom, that same knowledge is still there in the body. And so if we remove the obstacles to it, if we remove the stress that's really preventing us from switching over to that healing mode, then we'll actually be able to start healing and get back to that place of like oneness with our body, and that place where we can feel like we can flow and not have so much resistance and have to fight against our body so much. So that's what neurofascial integrative therapy is, and that's what it's giving, back to people. But again, for the most part, I just want to be here to be that partner with people be that partner for people when they're ready. And so whether it's with for the most part, all of my treatments are becoming neurofascial integrative therapy, not necessarily to the same degree as that longer treatment, because that treatment in particular is to create space for people to just get whatever they need. Whereas in a shorter treatment, of course, like, I don't recommend an hour for anyone, just because by the time the nervous system. So by the time I can get the nervous system to even calm down, sometimes we're 45 minutes into the appointment. And so now we just have 15 minutes to get this area to relax. Now, that's enough if that's the only area we have to work on. But in most cases, that's not the only area we have to work on. So now I got to try to get this area to relax, and then this area over here. And realistically, it's just not enough time. And so being able to set aside that time so that we can spend the time however we need to is, for the most part, what I want to create for people, the space that I want to create for the patient, so that they can really get whatever it is that they need.